good cookie that helps moms be prepared for any snack emergency. The good cookie!
So, very good afternoon. Yes, a very good afternoon to everyone. So, yesterday we are done with FMG exam and most of the questions were repeated. So, we'll continue our journey because the NEET PG exam is round the corner. And the yesterday question paper, if we will analyze, it was moderate, not very easy, not very tough. All the questions were repeated questions. And NEET also, we will expect moderate level of questions. Tough level of questions you will ask, it will be asked in INI-CET. And we usually conduct a special session for new drugs and rare questions for INI-CET as well. So let's continue our journey. And after this session, I'll be taking two more sessions in which we will finish whole pharmacology. I hope your all the queries are solved. So today we will start with anti-cancer drugs. So let's start without wasting any more time. So you can, if you have any doubt, you can ask me directly on Instagram, okay? Or there is a Facebook channel with the name Dr. Ankit Pharmacology Series, which is a closed group only for medicos. Only we talk about medical things, nothing else. Telegram you already have joined, and this is the YouTube channel, so you can share with your friends because knowledge is always meant for sharing. And when I will be giving you this PDF, you can directly tap on this link. It will be directed you to this specific video of anti-cancer drug, or you can scan the code below. Yes, many question came, Amrutaji, from our session yesterday in exam. So yes, remember in any exam, the questions are always repeated. Only the topics are always repeated. Okay. So it is a trend. ये हमेशा चलता है. So let's start with anti-cancer drug, and we will also cover certain questions on the drugs which act on immunity like thalidomide, cyclosporin, tacrolimus. So very good afternoon. So without wasting your precious time, let's start. So what is a drug of choice for neutropenia due to cancer chemotherapy? The answer for this question we all know is filgrastim. And how we can remember filgrastim? You can see a word, grass word is coming. Gra means granulocyte, which is neutrophil. Stim means stimulator. It will increase the levels of neutrophil. So question comes, what exactly this filgrastim is? Remember, filgrastim is a synthetic form of GCSF. GCSF stand for granulocyte colony stimulating factor. It's a protein which is also produced in our body, which increases neutrophil count. Granulocyte colony stimulating factor. And another question, it is given by injections only. Now remember, cancer chemotherapy not just causes neutropenia, it can also cause thrombocytopenia, platelet count will fall. It can also cause anemia, RBC count will fall. So oprelvicin, it is given for the treatment of thrombocytopenia due to cancer chemotherapy. Filgrastim is given for the treatment of neutropenia due to cancer chemotherapy. And erythropoietin is given for the treatment of anemia due to cancer chemotherapy. Now remember, what is oprelvicin? It is a very frequently asked question. It is ending with the word kin. And remember a rule, any drug which ends with the word kin is always an IL, interleukin. And you can see ELVE word is coming, so it is interleukin 11. And interleukin 11, remember, increases platelet count in our body. So erythropoietin is given for the treatment of anemia, but now from erythropoietin we have made other drugs also which will end with the word poietin like darbepoetin. This you can also give. It is also ending with the word poietin. You can also give epoietin. So all of them will be ending with the word poietin. And remember, another specific question is, all these drugs are given by injectable route only. None of the following drug is given by oral route. Fine. So next question is non-myelosuppressive agent. So the question is asking that which anti-cancer drug does not produce bone marrow suppression? Myelosuppressive means bone marrow suppression. So which anti-cancer drug do not produce bone marrow suppression? I'll give you the list. Remember a mnemonic VBC. Okay. VBC, very bone marrow count. You can make any mnemonic. The first drug is vincristine. No bone marrow suppression is seen. Bleomycin. And the third drug you have to remember is chlorambucil. And these are very frequently asked questions. So among them, you can see vincristine is there. Remember, vincristine does not produce bone marrow suppression. So if a question comes vinblastine, blastine is having B word in it, it causes bone marrow suppression. B for bone marrow suppression is seen. Okay. Then a cell cycle specific anti-cancer drug that mainly act on M phase of cell cycle. So beta, we all know when the cell divides, the cell starts from G1 phase, then it enters into S phase. In S phase, remember, in S phase, we know that synthesis or DNA replication happens. Then the cell enters into G2 phase. And lastly, it will end into M phase. M phase is known as mitotic phase, in which actual cell division occurs. The chromosomes, they get separated with the help of spindle fibers, and spindle fibers are made up of microtubule. So any drug which inhibits microtubule will inhibit the formation of spindle fiber. So the drugs which act on M phase are microtubule inhibitors because they inhibit the function of spindle fibers. Hence, mitosis will not happen, cell will not divide. Remember, there are two drugs which are microtubule inhibitor. The first drug is Vinca drug. And any drug which starts with the word Vin will be a Vinca drug. We just discussed two drugs, vincristine, vinblastine. And any drug that end with the word Taxol comes under a group of taxane. So these drugs, they will end with the word Taxol, like paclitaxel, doxytaxel. So they are microtubule inhibitor or they are spindle fiber inhibitors. They will act on M phase. So the answer of our question comes out to be paclitaxel. I hope it's perfectly fine with everyone. Okay, the volume is less. I think beta from my side, the volume is at maximum. Let me check if I can further increase the volume. Okay, let me check in my phone how the volume is coming. The answer of our question comes out to be it's perfectly fine. I think if any student is facing a problem of low volume, I would suggest if you have headphones or earphones, you can use that. That will help you to understand better. Okay. Now remember cisplatin. It is ending with the word platin. Any drug that ends with the word platin can kill the cell at any phase. So they are cell cycle non-specific. Fine. Etoposide, top word is coming. It is a topoisomerase inhibitor. Topoisomerase maintains the topography or the structure of DNA in S phase and G2 phase so that DNA can divide easily. So any topoisomerase inhibitor will end with the word G2 and S. Methotrexate, I will tell you, it's an anti-folate drug. Folic acid is required for DNA synthesis, and DNA synthesis occurs in which phase of cell cycle? S phase. So it is an S phase specific drug. Complete list I have already given you in regular lecture how to remember it. Okay, how to remember which drug acts on which phase of cell cycle. So which of the following anti-cancer drug is not S phase specific? Now this is an important question. Remember, in S phase, we know that DNA synthesis occurs. We all agree. DNA synthesis or DNA replication, one DNA gets converted into two in S phase of cell cycle. Now, the drugs which inhibit DNA synthesis will be acting on S phase of cell cycle. Do you agree? Yes. Now we have two drugs which act on S phase of cell cycle. The first is hydroxyurea. because hydroxyurea inhibits some ribonucleotide reductase enzyme. You don't have to remember them, but remember ribonucleotide, which is a component of DNA. And the second, which is very important, is anti-metabolites. Now, what do you mean by the word anti-metabolite? This is very important. So, beta, what do you mean by the word metabolites? Metabolite means these are the substrate required for DNA synthesis. Metabolite means the substrates which are required for DNA synthesis, and anti-metabolite means they are the fake substrate. They are the fake substrate like a normal substrate, and they will go to a DNA which is making a defective DNA will be produced. And if DNA will not be produced, remember the cell will not divide, they will be anti-cancer drug. Among anti-metabolite, remember we have three classes of drugs. One, we know folic acid is required for DNA synthesis. Purines is required for DNA synthesis. And third is pyrimidines are required for DNA synthesis. So these molecules are fake purines and fake pyrimidines. And how to remember their name? Any drug which will have Trex word in it will be a fake folic acid molecule. It will be an anti-metabolite group of drug, and it will inhibit DNA synthesis in S phase. So if I say an example, methotrexate, do you agree methotrexate will be an anti-metabolite? Similarly, purines, if I write a word 6-mercaptopurine, don't you think it will be a fake purine? Similarly, guanine and adenine are also purine. 6-thioguanine will also be a fake purine. If I write 5-fluorouracil, we all know uracil is a pyrimidine, and pyrimidines, they are also required for DNA synthesis. So 5-fluorouracil will be an anti-metabolite, inhibit S phase specific drug. So here the answer of our question is cyclophosphamide, because cyclophosphamide is an alkylating agent, which I will be telling you later on. And alkylating agent, just like platinum compound cisplatin, they are cell cycle non-specific drug because they can kill a cell at any phase of cell cycle, because they produce direct DNA damage. Okay, I hope you are absolutely correct, understood the concept. So which of the following are alkylating agent? You have to remember the names of alkylating agent except, but the answer is very simple for you. You can easily answer this question. I have already given you the trick. So which of the following are alkylating agent except? So the answer for our question comes out to be methotrexate. So Trex word is coming, sir. Beta, please recall, Trex word is coming. If Trex word is coming, it is an anti-folate drug. It is a fake folic acid molecule. And it will be under anti-metabolite group, not alkylating agent. And it will be S-phase specific drug. So this is a trick you should remember. So which of the following drug causes hemorrhagic cystitis? So hemorrhagic cystitis means the bladder, urinary bladder will become damaged. Agreed? And the patient will have painful hematuria. So sometimes instead of hemorrhagic cystitis, you will get the symptoms of hemorrhagic cystitis. And remember, two drugs can cause. The first is cyclophosphamide and its brother also ending with the word phosphamide, that is ifosfamide. So any drug that ends with the word phosphamide will damage urinary bladder and cause hemorrhagic cystitis. And the treatment of this hemorrhagic cystitis is caused by cyclophosphamide and ifosfamide. The antidote is Mesna. It protects the bladder. Mesna will be the antidote for the treatment. Okay, antidote for the treatment. Very good. So now next question is regimen for non-Hodgkin's lymphoma. So certain regimens you have to remember, that in which cancer regimen or combination of drug we use. So for non-Hodgkin's lymphoma, beta, we use R-CHOP regimen. The name of the drugs, even if you can remember, it's good. If you will not remember, it's fine. R for rituximab, C for cyclophosphamide, H for some hydroxydonorubicin, oncovin, and prednisolone. Remember, FOLFOX regimen, it is given for all GIT cancers, especially colorectal cancer, all GIT cancer. whether it is esophagus, stomach, colorectal, anal cancer. MOP regimen and ABVD regimen, which comprise of their drugs, it is given for the treatment of Hodgkin's lymphoma. But now the better regimen for Hodgkin's lymphoma has become ABVD. ABVD is a better regimen as compared to MOP regimen, if both questions will come. Fine. So now the next question is, Roopmati, a 56-year-old female with lymph node positive breast cancer, was treated with cyclophosphamide. Now she developed, so now you know the answer. She was treated with cyclophosphamide. Because beta, the treatment of choice in breast cancer is a regimen known as CAT regimen. In breast cancer, which regimen we use? CAT regimen. CAT regimen of breast cancer comprise of cyclophosphamide, A for adriamycin, and another name of adriamycin is doxorubicin. And any of the Taxol drug you can use like paclitaxel, docetaxel, etc. Now, because of cyclophosphamide, she developed frequent urination, suprapubic pain, dysuria, hematuria. So there is a painful hematuria. Yes, she's been suffering from hemorrhagic cystitis. The antidote is Mesna. Now let's write all other antidotes in one place only. Now folinic acid is an antidote for methotrexate toxicity. Folinic acid is an antidote of methotrexate toxicity. Dexrazoxane is an antidote of doxorubicin. Any drug that ends with the word rubicin, because these drugs are cardiotoxic drug, which I will be telling you. And to protect heart, we give an antidote, dexrazoxane. And amifostine is an antidote for cisplatin, or any drug which ends with the word platin. They damage kidney, nephrotoxicity, because this amifostine is a nephroprotector. So these are the various antidotes you have to remember for your upcoming exam. It's a very commonly asked question. So which chemotherapeutic or anti-cancer drug is used in astrocytomas of brain tumor? So brain tumor or astrocytoma, which is the most common type of primary brain tumor, the overall drug of choice is, remember, temozolomide. And in temozolomide resistant cases, we can give any drug that ends with the word mustine, like lomustine, carmustine, C-mustine. All these drugs are alkylating agents. So here the answer of your question comes out to be temozolomide. Okay, the answer comes out to be temozolomide. So methotrexate is the drug of choice for which cancer? Remember, sometimes instead of drug of choice, a clinical questions would have been given. They would have been explaining you a cancer, and in this cancer there is a very high beta HCG level. There is a very high beta HCG level. Now can you tell me the answer of this question? Yes, it produced a drastic response and a very good response in choriocarcinoma. Choriocarcinoma. Okay. So first let's talk about Burkitt's lymphoma. The drug of choice is cyclophosphamide. Hodgkin's we have discussed, we use a regimen ABVD or MOP regimen. And any genital cancer comes, genital tract cancer comes, whether it is testicular cancer, cervical cancer, ovarian cancer, the best drug we have is cisplatin. Now let's see where all methotrexate is used. So methotrexate, remember, apart from choriocarcinoma, methotrexate, it is also the drug of choice for rheumatoid arthritis, which we are going to discuss in upcoming chapter of autocoid. It is also the drug of choice for psoriatic arthritis. It is also used during to treat or terminate any ectopic pregnancy. It is also given in ectopic pregnancy as well. Now, apart from this, methotrexate has many uses. More than 50 uses are there of methotrexate. But you don't have to remember each one of them. Remember this part, only these three, it will suffice. Okay. Now, what is the drug of choice for cervical cancer? So recall, any genital tract cancer comes, you will go with which question, which answer? This was a question of last year. Drug of choice for cervical cancer. So answer is always cisplatin. In fact, it is the most commonly used anti-cancer drug. Okay, most commonly used anti-cancer drug, cisplatin. Cervical cancer. Okay. Now, let's write the uses of cisplatin. Remember, cisplatin is the most commonly used anti-cancer drug. We can make a mnemonic LOGUR because uses of cisplatin is very commonly asked question. LOGUR. It is the drug of choice for the most common cancer in the world, that is lung cancer. And in lung cancer, we give platinum-based therapy. Platinum-based therapy means we will use cisplatin-like drug like cisplatin, carboplatin, etc. It is also given in osteosarcoma. It is given in all GIT cancers, all GIT cancer, esophagus, stomach, colorectal. It is also given in all types of head and neck cancer. Now remember, in any type of head and neck cancer, I'll give you an example. If I say what is the treatment of choice for laryngeal cancer, if I say what is the treatment of choice for oral cancer, mandibular cancer, your answer will be your cisplatin. But remember, in all GIT and head and neck cancer, we give a combination of 5-FU with any drug that ends with the word platin. Most commonly, we give cisplatin. So in all GIT cancer and head and neck cancer, we give a combination of 5-fluorouracil with platin. There is a reason behind it. Because you cannot do extensive surgery in GIT and head and neck cancer, because all the vital organs in your body, the God has placed in this area only, head and neck area. You can't do extensive surgery in GIT cancers also. If a person will not able to eat, anyway the patient will going to die. So the mainstay of treatment of GIT and head and neck cancer is radiotherapy. And why we give combination of these two drugs in GIT and head and neck cancer? Because these drugs are radiosensitizers. They are also radiosensitizer. They make GIT cancer and head and neck cancer sensitive to radiotherapy. I hope you have understood the concept and you will never forget it now. Now, the next we have is urogenital cancer, like cervical cancer, testicular cancer. Agreed? Cervical cancer, testicular cancer, ovarian cancer. It is also given in retinoblastoma. One question came, which drug should be given in retinoblastoma? 2 years old question. And the option was having carboplatin. So any drug that ends with the word platin can be given in all of these following drugs. Okay? Understood this part? So which anti-cancer drug causes nephrotoxicity, kidney damage? And this drug is highly emetogenic drug. It causes maximum vomiting. Maximum vomiting also. The answer is cisplatin. And remember, the least toxic drug is maximum nephrotoxic is, and maximum vomiting is with cisplatin. But the safer option we have, which will have less risk of nephrotoxicity and less risk of vomiting, is carboplatin. Nowadays, instead of cisplatin, we are preferring to use carboplatin. So the question is how to treat this nephrotoxicity and vomiting because of cisplatin. Now, to treat nephrotoxicity, the antidote is amifostine. Antidote is amifostine. It is a nephroprotector drug given to protect kidney from platinum-based nephrotoxicity. And to treat vomiting, we give drug cetron. We start with the drug cetron. Cetrons are the drug which block 5-HT3 receptor of serotonin, 5-HT3 antagonist. And can you name certain cetron drug? Any drug which ends with the word cetron? Ondansetron, granisetron, tropisetron, any cetron. Pelonosetron, Romisetron. So Setron word will come. I hope you have understood this part. Next question. Tell me the answer. This question came in NEET exam, I think 1 or 2 years back. So what is the potent radiosensitizer in head and neck cancer? So I hope now you have understood the concept that in head and neck cancer, we cannot do extensive surgery. So because we cannot do extensive surgery in head and neck cancer, we have to give certain anti-cancer drug that makes the cancers which are radiosensitizer. So we gave a combination of cisplatin or 5-fluorouracil. These drugs are potent radiosensitizer in head and neck cancer and GIT cancers. Fine. So which drug is a now radioprotector? Radiosensitizer means activity of radiotherapy, the effect of radiotherapy will increase. But when we give radiotherapy, don't you think in head and neck cancer, radiotherapy will kill cancer cells? But they will also kill normal tissues as well. To protect the normal tissues during radiotherapy, we give a radioprotector. And that radioprotector again is amifostine. So why it is given? It is given during head and neck cancer to protect normal tissues from radiotherapy. To protect normal tissues like glands, salivary glands, and it is also a nephroprotector. It is given for the treatment of platin-induced nephrotoxicity. Cisplatin, carboplatin-induced nephrotoxicity. The answer is amifostine. You will find one old question that this amifostine is a radioprotector and nephroprotector, but in an old question, it is not a neuroprotector. It is not a neuroprotector. You'll find this MCQ. Fine. Fine. So this is the answer, beta. It is amifostine. So which drug is given for the treatment of sickle cell anemia? Remember, the drug of choice for the treatment of sickle cell anemia is hydroxyurea. Let's see the reason for it. Beta, you know that in sickle cell disease or sickle cell anemia, which is a genetic disease, there is a point mutation in beta chain of hemoglobin. So there is some defect in or point mutation in beta chain of hemoglobin. Beta chain of beta globin chain. Why we give hydroxyurea? Because hydroxyurea increase fetal hemoglobin synthesis. And fetal hemoglobin contains alpha and gamma chains. Remember, fetal hemoglobin does not require beta chains which are defective in sickle cell anemia. Now remember, for your NEET and INICT, certain new drugs for sickle cell anemia. What is a problem a person faces during sickle cell anemia is if the shape of RBC becomes sickled, just like this, these RBC, they stick among themselves, they stack among themselves, and they will block blood vessels like vein. So the main problem in sickle cell disease is veno-occlusion happens. Because of this reason, various organs like spleen, limbs, they become damaged. To prevent this veno-occlusion, a new drug got approved which has been asked in your exam, voxelotor. Remember a drug? Voxelotor. There are other new drugs also approved like crinzanlizumab, agree, which you don't have to remember. So remember veno-occlusion, V and O. Veno-occlusion is inhibited by a drug V and O. Veno-occlusion, X means inhibitor. Voxelotor is veno-occlusion inhibitor. It inhibits the sickling of this RBC. Now, which of the following drug is used to treat methotrexate toxicity? So, beta, I have told you methotrexate is an antifolate drug. Now, how it is an antifolate drug? Methotrexate inhibits a very important enzyme known as DHFR enzyme. This is a very frequently asked question which stands for dihydrofolate reductase enzyme. Dihydrofolate reductase enzyme, the name itself will tell you, it adds hydrogen to folic acid. That is why dihydrofolate reductase. Reductase means addition of hydrogen. So the function of this enzyme is to convert folic acid into its active form known as tetrahydrofolate. And this tetrahydrofolate is required for DNA synthesis or cell division. So methotrexate inhibits this enzyme in an irreversible fashion. That means now this enzyme cannot work irreversibly. Agreed? So now tell me, in the treatment of methotrexate toxicity, better drug will be folic acid or tetrahydrofolate. So in the treatment of methotrexate toxicity, if you will give folic acid, DHFR enzyme will not able to work. So it's better to give tetrahydrofolate as an antidote in methotrexate toxicity. And this tetrahydrofolate, which is an antidote, it is also known as folinic acid. The active form of tetrahydrofolate is known as folinic acid. And remember, the answer is folinic acid. There are two more names of folinic acid you have to remember. Folinic acid is also known as leucovorin. Another name is leucovorin. So, if I will ask you a question in a twisted way, leucovorin rescue is given in the poisoning of which drug? Leucovorin toxicity, leucovorin rescue is given in methotrexate toxicity. Third name is citrovorum factor. It is also known as citrovorum factor because it is obtained from some bacteria. We obtain this tetrahydrofolate, okay, from a bacteria. That bacteria name is Leuconostoc citrovorum. From there we have these two different name of folinic acid. I hope you have understood. So which of the following medication is essential for ameliorating or decreasing the toxicity of P matrix? But a very simple question. Again, can you tell me Trex word is coming? Trex word is coming. Can we say Trex word is coming? It is also a folic acid analog, just like methotrexate. So which answer you should give? Okay. See, you can give folinic acid. You can give folinic acid. But remember, vitamin B6 has no role. Because folic acid, for its function, require B12 enzyme. Vitamin B12. You know, folinic acid trap, folate trap will happen if we will not give B12. So here the best answer should be with B12 because B12 is given along with folic acid. Otherwise, folate trap will happen, which you will learn in biochemistry. Okay. So mechanism of action of 5-fluorouracil beta. I hope it's now very simple question for every one of you. Just see the name uracil is coming. So uracil is a type of pyrimidine, but it is a fake pyrimidine because it is having 5-fluoro word in it. All pyrimidines are metabolites required for DNA synthesis. So it's a fake metabolite which you will put under which group? It's under a anti-metabolite group. Can you tell me in which phase of cell cycle it will act? It is S phase specific drug. It will kill the cell in S phase. Okay. Now the things are very conceptual, I believe. Next is drug that produce thymidine deficient cell death. This question came last year. Let me tell you. You all know, beta, in DNA we don't have uracil. In DNA, we have thymidine. Uracil is present in RNA. So what happens in our cell is uracil, or let's write its nucleotide uridine. It gets converted into thymidine. It gets converted into thymidine. And thymidine is required for DNA synthesis because DNA does not have uracil. The enzyme which is required out here is thymidylate synthase enzyme. Do you agree with the name of this enzyme? Thymidylate synthase enzyme. Now, this thymidylate synthase enzyme will become confused between normal uracil and 5-fluorouracil, because 5-fluorouracil is a fake uracil molecule. So if we will give 5-fluorouracil, this thymidylate synthase enzyme will stop working. And can we say thymidine production will fall? And if thymidine production will fall, can we say cell will have thymidine deficiency? So yes, the answer is yes. The first answer is 5-fluorouracil. It decrease thymidine production and it causes thymidine deficient cell death. This question beta came last year in your exam. Okay, it came last year in your exam. Then we have hand foot syndrome. Can you tell me in hand foot the skin of which area will get damage? In hand foot syndrome, I'll explain you what is this. This question came this year also. It's a very repetitive question. The skins of palms and soles will become damaged. So palms and soles skin becomes damaged. Do you agree with this part? Now, there are two drugs which you have to remember. The first drug is capecitabine. And capecitabine is a prodrug. Its active form is 5-fluorouracil. And 5-fluorouracil is a separated drug. Now the point is that 5-fluorouracil and capecitabine, they have a propensity that these drugs are excreted out in sweat. These two drugs are excreted out in sweating. Can you better tell me that sweating occurs maximum in which part of the body? Palms and soles. So when they are excreted out in sweat, they will deposit in the skin of palms and soles, and the rapidly dividing cells of palms and soles will become damaged. And when they will become damaged, it will lead to a syndrome known as hand-foot syndrome. So remember, even capecitabine causes more as compared to 5-fluorouracil. So the drug which causes more risk is capecitabine. Capecitabine was asked last year your exam. Now gemcitabine. Remember, whenever the word gemcitabine comes, can you tell me a person who was a person who was a gem of a person, and he took the mobile industry. He was a genius person, gem person. I'm giving you a trick how to remember. He took the mobile industry, iPhone industry to the next level. Yes, we are talking about Steve Jobs. So remember, Steve Jobs was a gem of a person. And Steve Jobs died because of a very dangerous cancer, that is pancreatic cancer. Agreed? Pancreatic cancer. So gemcitabine can make this pancreatic cancer sensitive to radiotherapy. So it's a radiosensitizer in a very dangerous cancer, pancreatic cancer. So this is a trick you can remember, okay? Otherwise, it will be difficult for you to remember in the last moment. So that gem of a person is Steve Jobs. He died from pancreatic cancer. So the following drugs act by hypomethylation of DNA in myelodysplastic syndrome. So beta, let me tell you that what is this myelodysplastic syndrome, MDS? What happens in MDS? The bone marrow cells, their DNA, if I will talk about their DNA becomes hypermethylated. The DNA becomes hypermethylated. Methyl group attaches to DNA. So DNA becomes hypermethylated. And remember, hypermethylated DNA, it can divide anytime. Hypermethylated DNA, it can divide easily. You can remember, it can divide easily. It can divide easily. So if it will divide easily, it can lead to any type of blood cancer. So that is why in MDS, myelodysplastic, dysplastic means abnormal cell whose DNA can become active anytime. And it can lead to variety of cancers in bone marrow. It can cause polycythemia, RBC cancer. It can cause thrombocytosis, platelet cancer. It can, because these are the stem cells present in myeloid cell. Now, where this methyl group attaches? Methyl group attaches to cytosine part of the DNA. Agreed? So, if we make a drug which is a fake cytosine, if we make a drug which is a fake cytosine or cytidine, better word is cytidine. Cytidine are present in DNA. They will inhibit methylation of DNA. So the drug name is, see the name, azacitidine. Azacitidine is having cytidine word in it. So if we give azacitidine or decitabine, they are fake cytosine molecule. In them, methyl group will not able to attach. If methyl group will not able to attach, these drugs are known as hypomethylating agents. These drugs are known as hypomethylating agent, and they are now considered to be the drug of choice for MDS, myelodysplastic syndrome. We give azacitidine or decitabine. Some cytidine word will come. A new drug which has been approved for the treatment of myelodysplastic syndrome is thalidomide. Thalidomide can also be given. Okay, thalidomide can also be given for the treatment of MDS. Next is cerebellar toxicity is seen with a drug C for cerebellar. Remember cytarabine. Cytarabine, it is also known as cytosine. So it's a fake pyrimidine, arabinoside. Now this cytosine arabinoside cytarabine, it is given for the treatment of AML. And it is considered to be the drug of choice for AML. And it causes cerebellar toxicity. And you know the symptoms of cerebellar toxicity. Coordination of movements will be lost, because cerebellum maintains body coordination, movement coordination. Diplopia, ataxia, slurred speech will happen. Okay. So which of the following drug is an immunosuppressive drug, but it lacks anti-cancer activity? So this drug is not an anti-cancer drug. It is only immunosuppressive drug. The answer is very famous used drug is azathioprine. So azathioprine is not an anti-cancer drug. It is only given to reduce immunity. It is the drug of choice for IBD, inflammatory bowel disease like ulcerative colitis and Crohn's disease. Okay. It is also given in other autoimmune diseases like myasthenia gravis, multiple sclerosis, etc. Now, fludarabine, arabine word is coming. It is a fake adenosine analog. And this is a very commonly asked question. It is a drug of choice for CLL. In CLL, we use a regimen known as FCR regimen. So let's write the regimen of all blood cancers. Okay. FCR regimen stands for fludarabine, cyclophosphamide, and one monoclonal antibody rituximab. So it is given in CLL. In CML, remember, we give imatinib, etc., which I will be telling you. These drugs are BCR-ABL inhibitor, because in CML, the most common mutation you will find is BCR-ABL mutation. In ALL, we use a regimen known as VPAD regimen. And in AML, we use a combination of cytosine arabinoside, which we just discussed, cerebellar toxicity, with doxorubicin. This is the treatment of, you don't have to remember. No, beta. It can occur anyway. NP24, it can activate DNA, it can suppress DNA, it can occur both way. You will learn in biochemistry epigenetic action. Okay. Now, which of the following drugs is used in the treatment? Last year question, hairy cell leukemia. So for hairy cell leukemia, the drug of choice is cladribine. Remember, cladribine is the drug of choice for two cancer, hairy cell leukemia. And sometimes you will get a picture of hairy cell, hairs over lymphocyte. And this hairy cell leukemia It occurs with which virus infection? Epstein-Barr virus infection also. It is also the drug of choice for tumors of macrophages. Tumor of macrophages is known as histiocytosis. Histiocytosis, cladribine. Now, the dose of 6 mercaptopurine is reduced by 1/4 when given along with. This is a very frequently asked question. So remember, there is a drug known as 6 mercaptopurine. I'll write the short form. 6 mercaptopurine. And just write another drug which is not an anti-cancer drug, only an immunosuppressive drug, azathioprine. Because azathioprine is a prodrug. Its active form is what? Its active form is 6 mercaptopurine. Now remember, all purines in our body, they go to the liver. All purines, they are fake purines, but in our body, natural purines are also produced. All purines in our body, they go to the liver, and in liver, they are degraded by an enzyme known as xanthine oxidase enzyme. They are degraded by any enzyme, xanthine oxidase. In our body, purines, when acted on by xanthine oxidase enzyme, they are converted into uric acid. So we know we have a drug which is a xanthine oxidase inhibitor, allopurinol. So how we can remember? Sir, purine word is coming in this drug also. Don't you think purine word is coming in 6 mercaptopurine? Azathioprine, again some purine word is coming. So allopurinol, by inhibiting xanthine oxidase enzyme, can increase the toxicity of these two drugs. So you have to reduce the dose of this drug by 1/4. Initially you are giving 100 milligram. Now the dose you will give is 25 milligram. So the drug which is not acting on tubulin protein. So beta, tubulin protein, I have told you, microtubule inhibitors or spindle poisons. So either they will start with the word vinca, or they will end with the word taxane. Okay? So paclitaxel, vincristine are microtubule inhibitor. They are anti-cancer drug. But there is one more drug which is a microtubule inhibitor, that is colchicine. And colchicine is not used in cancer, although it was made initially for the treatment of cancer. But now colchicine is given in the treatment of acute gout. And it is also given as a spindle poison to arrest the cell cycle during mitosis. And we can count the name and shape of chromosome. It is also given in karyotyping. So answer out here would be your bleomycin. Okay. So these drugs are microtubule inhibitor, you have to remember. Now, peripheral neuropathy is a side effect of which anti-cancer drug? Remember, peripheral neuropathy is a side effect of microtubule inhibitors. Because in a neuron is a very big molecule. You have to transport things anterograde and retrograde fashion. And these things are transported inside a neuron with the help of microtubule protein. So that is why microtubule inhibitor like vinca drug and taxane drug, they can cause peripheral neuropathy. So the answer of our question comes out to be again vincristine. Okay, vincristine. Fine. So which drug should be avoided in Crigler-Najjar syndrome? A straight away question. Remember two drugs which should be avoided in Crigler-Najjar syndrome. The first drug is an anti-cancer drug because it will not be removed out of the body. In Crigler-Najjar syndrome, you know, glucuronide enzymes are deficient. UDP, GT enzymes are deficient. GT stand for glucuronide enzyme. So certain drugs are removed with the help of glucuronide enzyme. So if they are deficient in Crigler-Najjar syndrome, toxicity will come. So which anti-cancer drug should be avoided? Irinotecan. Its toxicity will come. And there is a drug which is used in HIV virus. The drug name is atazanavir. So these drugs are contraindicated in Crigler-Najjar syndrome. You have to remember these two drugs, commonly asked question. So irinotecan was the recently asked question. Okay. Okay. Colchicine is used in acute gout beta. It is safe in renal failure. Febuxostat can also be given in Febuxostat is used in chronic gout, not in acute gout. It can also be given in renal failure, but we have to reduce the dose. Now, the most characteristic side effect of adriamycin. Remember, adriamycin is a very generic name. Actual name of a drug is rubicin, doxorubicin. So remember, any drug that ends with the word rubicin, like doxorubicin, donorubicin, idarubicin, valrubicin, epirubicin. Rubicin means they are red colored drug. That is why, because the color of these drugs are red, we call them as rubicin, just like a ruby stone. And when red color comes in our mind, Valentine Day also comes in our mind. And when Valentine Day comes in our mind, heart also comes in our mind. So any drug which ends with the word rubicin produce a side effect of cardiotoxicity. And in cardiotoxicity, they can cause dilated cardiomyopathy, which is a permanent damage of heart. There is no treatment. And to treat this cardiotoxicity, the antidote we have already discussed. The antidote is dexrazoxane. It's an iron chelator which protects the myoglobin which is present in heart which contains iron. Okay. Now, pulmonary fibrosis, very frequently asked question. I think yesterday also again it was asked pulmonary fibrosis, है ना? Last year also pulmonary fibrosis came. And flagellate pigmentation on skin, feather-like pigmentation on skin, is a side effect of a drug known as bleomycin. Don't forget it, beta. Bleomycin. Cisplatin we have discussed, nephrotoxicity. Methotrexate we have discussed, antifolate drug, so it will cause megaloblastic anemia and it is a highly hepatotoxic drug. Actinomycin, which is also known as dactinomycin. It is a drug of choice for Wilms tumor. It is a drug of choice for Wilms tumor. And one question which comes on dactinomycin or actinomycin D is its side effect is radiation recall syndrome. It causes radiation recall syndrome, although it can be shown by various anti-cancer drugs, but specifically this is asked. Radiation recall syndrome means that there is damage to skin with dactinomycin in which area? Which were prior exposed to radiotherapy. Which were prior exposed to radiotherapy. Let's imagine you have given a radiotherapy. After radiotherapy session is over, now you are starting chemotherapy in a patient, dactinomycin. Let's say you have given radiotherapy here. So here now the skin will become more damaged. Okay. Now topical mitomycin C is used in. Remember mitomycin C, it kills fibroblast. You know that fibroblast, it damages, it deposit collagen protein. And when collagen protein is deposited, it will lead to fibrosis in an area. Because of this reason, mitomycin is given as an anti-cancer drug to inhibit fibrosis. Now the question is, sir, when fibrosis happen? Fibrosis happen after radiotherapy. Don't you think if you have given radiotherapy in head and neck cancer, the cancer cells will get killed? And those killed cancer cells will be replaced by fibrosis or collagen deposition, dead material, dead protein. Now just imagine you are giving radiotherapy for laryngeal cancer. When you have killed the cancer cells, these cancer cells will be replaced by fibrotic material. Now it will lead to laryngeal stenosis. It will lead to laryngeal stenosis. So after you are done with the radiotherapy, to prevent this laryngeal stenosis, here you will inject mitomycin C. to prevent fibrosis, to prevent narrowing of this larynx. Yes, especially during subglottic laryngeal cancer, because subglottic part is one of the narrowest part of larynx. Now, where BCG vaccine is used? So, BCG vaccine, although it is a vaccine for tuberculosis, but it is also used in one cancer known as bladder cancer, superficial bladder cancer. So, suppose this is a urinary bladder and there is a bladder cancer. So, we can directly inject a drug into bladder cancer intravesically. So, we can intravesically inject BCG vaccine. You can also give mitomycin for the treatment of bladder cancer. These two drugs can be given. Okay. Because BCG vaccine increases immunity, it will stimulate natural killer cells, macrophages. It will recruit those WBC and those WBC will kill or eat up this cancer cells. Now, all trans retinoic acid. Let's write the short form of all trans retinoic acid as ATRA. All trans retinoic acid, vitamin A. It is also known as tretinoin, sometimes given in acne. And you will write another drug, arsenic trioxide. Arsenic trioxide. These two drugs are given in the treatment of APML. It is the only variety of AML, which is AML type 3, which has the best chances of survival because we have two drugs, ATRA and arsenic trioxide, which can produce drastic response in the treatment of this cancer. All other variety of AML, they have a very poor prognosis. Only AML type 3 or APML, it has the best prognosis. Okay. It has the best prognosis. Yes, the RARA mutation, retinoic acid mutation is there. Now, imatinib inhibits by. So remember, imatinib, any drugs which ends with the word nib or tinib, any drug that ends with the word tinib is a T for tyrosine kinase. Inhib stand for inhibitor. Now, what do you mean by tyrosine kinase inhibitor? Remember, on our cell, we have a receptor known as tyrosine kinase receptor. And if this receptor becomes mutated, it leads to rapid cell division and it can lead to cancer. Any mutation in tyrosine kinase receptor can lead to cancer. So we have developed an anti-cancer drug which will block this tyrosine kinase receptor. They will end with the word tinib. So imatinib inhibits BCR-ABL tyrosine kinase inhibitor. And it is the drug of choice for two tumor. The first is CML, because in CML, the most common mutation, chronic myeloid leukemia, the most common mutation you see is BCR-ABL mutation. Another cancer you have to remember where imatinib is used is GIST, gastrointestinal stromal tumor. Fine. Gastrointestinal stromal tumor. Two uses of imatinib. Yes, they are similar to JAK-STAT receptors. Not exactly, but they have same function. So what is the treatment of chronic phase of CML, chronic myeloid leukemia? So let me tell you, in CML, we give BCR-ABL tyrosine kinase inhibitor. So the first drug you will start is, overall drug of choice is imatinib. Agreed? Now in imatinib resistant cases, you will start nilotinib, dasatinib, and bosutinib. Bosutinib. These drugs you have to remember. So here the answer would be your nilotinib. Just remember a follow-up question for NEET exam. The main side effect of this drug is pulmonary artery hypertension. Their side effect is pulmonary artery hypertension. A follow-up question. Irlotinib, it inhibit another type of tyrosine kinase receptor known as EGFR receptor. EGFR beta stands for epithelial or epidermal. growth factor receptor. And epithelial growth factor receptor, which is a type of tyrosine kinase receptor, this mutation occurs in most common cancer of the world. It is given in non-small cell lung cancer. It is given in non-small cell lung cancer. The most common mutation seen in lung cancer is EGFR mutation in tyrosine kinase receptor. Lapatinib, it is given in HER positive, 2 positive breast cancer. It blocks HER receptor, human epidermal growth factor receptor, which is resistant to one drug I will be telling you, trastuzumab. Lastly, we have is Venditanib. Remember Vande Mataram. Mataram means it is given for medullary carcinoma, medullary carcinoma of thyroid. Medullary carcinoma of thyroid. So now tell me the answer of this question. Trastuzumab resistant breast cancer. So first let's talk about where trastuzumab is given. So remember trust her. Remember a mnemonic? Trust her. So trastuzumab means it is given in trust her. Her. How many times you will trust her? Twice. First time you will forgive her. Next time you will not forgive her. So trust her twice. So it is given for HER positive breast cancer. Trust her twice. Remember like this. Okay. Second point, if she breaks your trust, you will feel pain in your heart if she breaks your trust. So the main side effect, if your trust is broken, the main side effect is cardiotoxicity. Do you agree with this part? Now she has broken your trust. You started to take revenge. Because you want to take revenge, you went to her and you slapped her. Take it, don't take it otherwise. Just to make your things easier to remember, you will give a lapa. Lapa stands for slapping. In Hindi, slap means lapa. So in trastuzumab resistant cases, you will give a drug lapatinib. So remember this story by heart. Some of you must have experienced also. Okay. So answer out here is lapatinib. Fine. Proteosome. Zome word is coming. Can you tell me among these four options, which option is having zome word in it? Can you tell me among them, which drug is having zome word in it? Proteosome, bortezome. Do you agree? So bortezomib is a proteasome inhibitor and it is now considered to be the drug of choice for multiple myeloma. Now the question, last year NEET question is, what is the side effect of bortezomib? The main side effect of bortezomib is it is ending with the word zomib. So a person will become zombie. So we can also remember a person will become zombie. Zomib, zombie ban jayega. Have you seen the face of a zombie? Have you seen Game of Thrones? Night Walkers? है ना? Can you tell me their face is teda? है ना? This is zombie. Can you tell me which viral infection leads to zombie-like face? Facial nerve paralysis will happen. Which viral infection will lead to zombie-like infection? Can we say herpes group of virus, Bell's palsy? Zombie-like face happens like this. So it increases the risk of herpes zoster virus. Because it reduces immunity of the body. All anti-cancer drugs can reduce immunity of the body by killing lymphocyte and opportunistic infection can happen. Okay. Next point is very important. Abemaciclib, riociclib. Any drug which ends with the word ciclib is given for the treatment of ER positive breast cancer. A new drug for estrogen receptor positive breast cancer. Parib, any drug that ends with the word parib like talazoparib, rucaparib, olaparib, Any drug which ends with the word parib is a new drug approved for treatment of BRCA positive, BRCA positive breast cancer. New drugs you have to remember. Venetoclax, CL word is coming. Venetoclax is approved for CLL, a new drug approved for CLL. It inhibits some BCL2 protein. Yes, cyclin inhibitor. Abemaciclib is CDK4, CDK6 inhibitor. Cyclin dependent kinase inhibitor. Okay. Talazoparib, olaparib, they are PARP inhibitor, poly ADP ribose phosphate inhibitor. It's impossible to remember the full name. Parib, they are BRCA positive. They inhibit an enzyme, PARP. PARP enzyme is responsible for production of certain proteins which causes DNA damage. Okay. Now in BRCA positive gene, remember BRCA is a tumor suppressor gene. It is responsible for protection of DNA. Sorry, है ना? So DNA becomes replicated. Don't go into detail. I have already explained you there. Nobody is asking you in a short MCQ the full mechanism of action. I've already explained you in regular lecture. Even in this, you can see in this YouTube channel, just type targeted therapy or monoclonal antibody. I have explained you the mechanism of each and every drug in great detail. So in this YouTube channel, you can find if you want to go into the detail part. Okay. Okay, parab mechanism, है ना? Just remember. Which of the following monoclonal antibody is fully humanized? Now remember, the first monoclonal antibody which we made was from mouse origin. And monoclonal antibodies are made by a technique known as hybridoma technique. They are made by hybridoma technique, in which we take mouse spleen cells and we fuse with them multiple myeloma cell. A hybrid cell is produced which makes antibody. If this is 100% mouse origin, it will end with the word MOMAP. It will end with the word MOMAP. But now what we are doing, it will produce lot of allergic reaction in human. So what we did, 50% or the lower portion, FC portion of this mouse antibody, we converted into human form. So 50% human, 50% mouse, 50% human and 50% mouse. This is known as chimeric. Chimeric means mixture. And any monoclonal antibody that will end with the word ZMAP will be a chimeric one. Similarly, we tried to make 95% human. We call it as humanized. It will end with the word ZUMAP. And then we made 100% human, fully human. It will end with the word MUMAP. Now you will remember the word MOMAP, mouse, ZMAP, chimeric, ZUMAP, humanized, and MUMAP, fully human. Can you tell me now which of the following is a fully human monoclonal antibody? It will end with it will end with which word? MUMAP. So can we say the answer out here should be Adali MUMAP, Admi wali? So answer. Cetuximab, rituximab, they are chimeric. Tocilizumab, tocilizumab will be your mouse origin. If I say trastuzumab, zumab word is coming. It is humanized. Fine. Now, bevakizumab beta we have already discussed. Anyone who can tell me? Bevakizumab means B for it inhibit blood vessel formation. Blood vessel formation means angiogenesis by inhibiting VEGF. So it's a monoclonal antibody which inhibits VEGF. That means it inhibits angiogenesis. Because it inhibits angiogenesis, which is the hallmark of cancer. Remember, it is used or approved in more than 100 cancers. Just you have to remember two cancers, breast cancer and colorectal cancer. You have to remember only two cancer and etc. So monoclonal antibody against other molecule, just you have to remember against EGFR is cetuximab. Cetuximab has been approved for lung cancer and colorectal cancer. You just have to remember cetuximab. Now, correct pair and drug mechanism of action. Erlotinib inhibit EGFR1. This is true. Epidermal growth factor receptor, approved in the treatment of lung cancer. Okay. Trastuzumab inhibit HER2. True. Given in breast cancer. Cetuximab is an angiogenesis inhibitor. Now, this is a false statement. Okay. Angiogenesis inhibitor was your bevakizumab. Now, rituximab, another important drug. Remember, there is a girl named Ritu, and the age of the Ritu is 20 years. So, it blocks CD20 receptor on B lymphocyte. It's a true statement. तो एक ऋतु है, ऋतु की एज 20 years है. Okay, you can remember. Rituximab blocks CD20 receptor on B lymphocyte. There are many new drugs which are FGFR inhibitor, fibroblast growth factor inhibitor. They will end with the word fratinib. New drugs never has been asked. You can see my regular lectures on this YouTube channel or Prep Ladder. You can also see lectures and you can find there. So immune checkpoint inhibitor approved for lung cancer and endometrial cancer is very important drug, pembrolizumab. Pembrolizumab inhibit program death. It inhibits program death ligand 1. This is some receptor present on lymphocyte program death receptors, which leads to death of lymphocyte. So if you inhibit death of lymphocyte by inhibiting program death receptor, can we say the level of lymphocyte will increase? Because you are inhibiting death of lymphocyte, and it will increase immunity of the body. And if the body immunity will increase, it will kill cancer cells. So that is why it is known as immune checkpoint inhibitor pembrolizumab. Now, uses of pembrolizumab is very, very important for you. It's a very commonly asked drug. It has been approved for more than 50 cancers now. So remember, it has been approved for lung cancer. You have to remember. And this pembrolizumab lung cancer, there was a clinical trial known as keynote trial. इस trial का नाम क्या था? Where it was found to be effective in lung cancer, keynote trial. I know this is a tough thing, but it has been asked. It has been approved for endometrial cancer also. Okay. Plus variety of other cancers. Adalimumab, it inhibits TNF alpha. Approved for the treatment of rheumatoid arthritis. Raxibacumab, I think we have discussed it in antimicrobial. Back word is coming. It is against which bacteria? Can you tell me it is against which bacteria? Raxibacumab. Back means bacteria. AX means which bacteria comes in your mind? It inhibits anthrax bacteria. Palivizumab. VI word is coming. It is against which virus prevention? RSV virus prevention. This part we have discussed in antimicrobial chapter as well. So next is remaining 4-5 questions are there now. I hope it's a tough topic. Which of the following is an example of calcineurin inhibitors? Okay. So beta, let me tell you the drugs which act on immunity. If you will understand it, it's a very complex thing to understand. Certain drugs that decrease immunity of the body. How? Let's say there is an antigen presenting cell which is bringing an antigen, and this antigen goes to T helper cells, especially T helper 1 cells. And on T helper 1 cells lymphocyte, we have a pan T cell marker, CD3 marker. So when they recognize this CD3 receptor inside the T cell, one enzyme becomes activated. The enzyme which becomes activated is calcineurin enzyme. And this T cells will now start producing interleukin 2. And this interleukin 2, remember, increases cell-mediated immunity. How? How it increases cell-mediated immunity? It goes to T cytotoxic cells. It will go to which cells now? T cytotoxic cells. And on T cytotoxic cells, it will start one pathway known as mTOR pathway. Because of mTOR pathway, these cells will divide. These cells will divide. And when these cells will divide, they will kill this foreign antigen. Let's say that foreign antigen is organ transplanted done. So these drugs are given for organ transplantation. So remember, the first drug you have to remember is calcineurin inhibitor. It will be used as a drug of choice in organ transplant people because it will decrease cell mediated immunity. So the drug name is cyclosporin. So what is cyclosporin? It is a calcineurin inhibitor. Reduces cell mediated immunity by decreasing the production of interleukin 2 in Th1 cells. Drug of choice for organ transplant people. Then we have a drug which are mTOR inhibitor. Drugs are sirolimus, everolimus. Agreed? They are another new drug. Then we have a drug that will block interleukin 2 receptor. The drug that block interleukin 2 receptor is basiliximab. Another drug for organ transplant, and a drug which blocks CD3, muromonab. Now these drugs you don't have to remember, you just have to remember calcineurin inhibitor and sirolimus and everolimus. These two drugs you have to remember. mTOR inhibitors and calcineurin inhibitors. I hope you have understood. So tell me, what is the answer out here? Cyclosporin and tacrolimus. They are calcineurin inhibitors. Sirolimus, mTOR inhibitor. Thalidomide, we will come shortly. So FK506. Remember, FK506 is another name of tacrolimus. Tacrolimus is also known as FK506. When it was under clinical trial, we used to call it as FK506. Later on, it got approved. So it is given as a drug of choice in organ transplant people. Okay. Now, which of the following drug causes nephrotoxicity? Cyclosporin inhibitor, cyclosporin and tacrolimus, which are the drug of choice for organ transplant people, remember, they produce nephrotoxicity. And in nephrotoxicity, they can cause damage of renal tubules, which will lead to hyperkalemia. So that is why you have to monitor the level of potassium inside the blood. Agreed? Second point, among this cyclosporin and tacrolimus, remember, cyclosporin also produce cosmetic effect. Cosmetic side effect is produced by tacrolimus or cyclosporin. Apart from nephrotoxicity, it can lead to hirsutism, just like phenytoin, hyperplasia of gums, hyperplastic gums. It is additional side effect of cyclosporin. Fine. So tell me the answer. Which of the following are the toxicities of cyclosporin except this question came? So nephrotoxicity, yes. Hyperplastic gums, yes. Hirsutism, yes. The answer out here is hypokalemia. Remember, they don't produce hypokalemia. They rather produce hyperkalemia. Fine. Hyperkalemia. So which of the following is an adverse effect of thalidomide? So remember, first, what is the mechanism of action of thalidomide? It's a very important drug. For your INI-CT exam, every year question comes on thalidomide. Let me tell you everything about thalidomide. So thalidomide is an immunity modifier. It is an immunomodulator. It decreases cell-mediated immunity by inhibiting the production of TNF alpha. It is also an angiogenesis inhibitor. That is why it is used in cancers. Fine. Uses of thalidomide. Remember TOM. Very important. It is given in type 2 lepra reaction. I think we remember the name of type 2 lepra reaction, ENL, erythema nodosum leprosum. It is given in oral ulcers, which is seen in Behçet's disease. It is given in MDS, myelodysplastic syndrome, and along with bortezomib, it is given in the treatment of multiple myeloma. Now, thalidomide's side effect is, let me tell you the history of thalidomide. Remember, thalidomide, it was made as a sedative drug. It was made as a sedative drug. Sedative for the treatment of morning sickness. You know, morning sickness is the vomiting which is seen in first trimester of pregnancy. Agreed? Remember one rule. Any drug which is a sedative drug causes constipation. Any drug which is a sedative drug causes constipation. This is a rule. But later on, it was found to be teratogenic in pregnancy. And it was causing phocomelia. Now, what is the cause of phocomelia with thalidomide? Remember, thalidomide inhibit one protein inside the fetus known as cereblon protein. Cereblon protein is responsible for organ formation, limb formation. Short limbs means phocomelia, cereblon protein. Okay. But the most dangerous side effect of thalidomide is not phocomelia. The most dangerous side effect of thalidomide is it is highly neurotoxic drug, permanent neuronal damage. So these all points you must remember. So go with the answer, diarrhea. Okay, except the question is asking except. So it causes phocomelia, thalidomide, poly. So this finishes our chapter of anti-cancer drug. I hope you enjoyed a tough topic. I went little bit slow this time because it is a very difficult topic to understand at a level of MBBS right now. Sooner or later, when you will grow in your life, let's say you become an oncologist, you will understand it much better. Probably we will meet after few years and again we will discuss anti-cancer in great detail. So for this moment, this is all you need to remember for your upcoming NEET exam. FMG has been done. Fortunately, there was no question on anti-cancer drug this time in FMG exam, but last year many question came. Okay, so you can ask your doubts, share with your friends, all these things who need to understand anti-cancer drug. Okay, so best wishes, keep learning and enjoy your day. Don't take stress of studies. Okay, if you'll enjoy your study, it will be a better thing to do. You'll enjoy your journey as well. Okay, results is not in your hand. So whatever the time is left, remember for your upcoming exam, don't have any kind of stress because this is just another exam for you. You have already given many exams in your life. So this is just another exam. And remember, even after you clear up this exam, there are many more exams in your life which you have to clear. So exams are the part of your life. Okay? Don't take stress. Yes, in gout you can give in renal failure, allopurinol and febuxostat. Okay? Theophylline mechanism of action, don't worry. We are upcoming with respiratory system. Only 2 days are left. I'll cover everything in next 2 days. Theophylline mechanism, I will tell you. The main mechanism is phosphodiesterase 4 inhibition. But it has also has other mechanisms like blocking adenosine A1 receptors. Okay. So one we will discuss is CVS part. Second, we will discuss all the small topics, respiratory system, autocoids, GIT system. We will combine all these 3 units together. We will take one session and we will take whole CVS, which includes blood, kidney, heart disease together. We will take it. And in 2 upcoming sessions, we will finish it. I think. So best wishes, enjoy your day. So I'll share the PDF on group, Telegram group, share with your friends so that they can also get benefit from this lectures. Okay, best wishes. Yes, everything will be covered. I'll not leave anything, any stone unturned.